DFL majorities in the House and the Senate were able to pass the largest budget in Minnesota history and enact many policy changes during last year's session. Joining me to talk about some of the priorities of the House DFL for the 2024 session is Majority Leader Jamie Long. Thank you so much for joining me today.
Thanks for having me. Really appreciate it.
So DFLers accomplished a lot last session. This is a brief and not complete list by any means. You passed a budget. There was a $2.6 billion bonding bill. You codified abortion rights. There's paid family and medical leave, significant investments in education and housing, legalizing recreational cannabis for adults. There's more. What is left to accomplish?
We did have a historic year, and I think are really proud of what we were able to accomplish last year. After years of, frankly, being gridlocked at the Capitol, we were able to, I think, get a lot done that Minnesotans have been asking for and demanding for many years. But there's a lot left to do. So we have a long list still to do this year. For one thing, we're going to do a second bonding bill, and we had not done bonding bills for many years. So that's investing in our public infrastructure across the state, our roads, bridges, and universities, et cetera. And then we have a few items that didn't quite get finished last year that we need to make sure we're getting done this year. So one of those is a public option bill. That's a bill that I'm the lead author of. And last year we authorized a report and study to make sure that we were ready to go to draft the final bill. So this year we'll be working on that.
So and by that you mean universal health care?
No, it would be allowing folks to buy into Minnesota Care. So Minnesota Care is a really successful program we've had since the early 90s and bipartisan program, but it's capped for its income. And so we're looking at ways to remove that cap, allow more people to buy in. So these are folks largely on the individual market or without health insurance who don't have access to affordable health care, or the health care that they have they really can't use. So trying to expand access to folks. So that'll be a big focus. We know there's going to be a lot of conversation still on housing. We have still some of the some real challenges and struggles across the state with getting access to affordable housing and the so-called missing middle house of folks who are looking to make that bridge from a starter home. So we need to do a lot of work there. In the climate space, I think there's still a lot of work to do. And then we also are going to have a really important conversation on the Equal Rights Amendment. So lots of work ahead.
Lots of work ahead. You mentioned a bonding bill. The Governor Tim Walz and Lieutenant Governor Flanagan outlined a $982 million package. Do you have a number in mind yet? Is that about the range you're looking at?
I think so. I think we're trying to make sure we're maximizing what we can achieve with the budget room we have. And so we'll know more when the new forecast comes out in February. But I think everybody's on the same page that we want as big a bill as we can afford. And we just have so many needs across the state. Our capital investment committees have been touring the state, meeting with local communities, hearing about their projects. And a lot of these have been waiting in line for years. And we really need to make sure we're taking care of our infrastructure around the state.
Now, you mentioned the February budget and economic forecast. It's about a month away, but I want to ask you about November's forecast just a few months ago, because there was kind of a warning about a structural imbalance in the following biennium, not this budget cycle, but in the next budget cycle. How are you viewing the state's financial and economic health right now, considering the forecast that you do have the numbers on?
Well, our health is strong. We have the top rating from all of the credit agencies. We have a very large rainy day fund that is fully funded, and we didn't even have to use in the last in the pandemic. And so we're in good shape. This biennium, we do still have a surplus, so we're looking out in years 3 and 4. And one thing that we changed this past year is that we now account for inflation when we're doing budgeting. So we hadn't really been doing honest budgeting in previous years, and now we are, which is important. It means that we're not going to be giving our schools or our medical systems less than they would be able to afford going forward. So when we fully account for inflation, then we do have this structural imbalance in years 3 and 4. So I think that does mean that we need to proceed with some caution, as the governor has said, and looking at those years. It may change a little bit in the February forecast. But I think we're being very responsible as Democrats with making sure that we're doing honest budgeting and making sure that we're not going to be putting ourselves into holes in future years.
One slide in the November forecast presentation projected an increase in costs for disability waivers. There's also a recent report from the Department of Human Services that said Minnesota's low medical assistance reimbursement rates are negatively impacting mental health services. So these are just two areas potentially in need of additional resources. What do you say about expectations when it comes to things like that?
We by no means have met the needs of our state, even though we had a historic year last year with the budget surplus that we were fortunate to have, and invested that in really important efforts for Minnesotans to help them afford their lives, to help them receive the care they need. We know that we're digging out of, frankly, decades of underinvestment in a lot of areas, in our schools, in our healthcare system, in our infrastructure. And we do budgeting on a 2-year cycle, so this year is not a big budgeting year. We'll have potentially a little bit to spend, depending on where the forecast comes out. But we're really looking ahead to 2025 and 2026, and I think are going to be making an argument to Minnesotans that having Democrats in charge means we get things done, and it means that we're able to actually invest in a lot of these programs that have been underinvested in for many years.
According to Axios, people in Minnesota tried to place bets online in other states where sports betting is legal 1.6 million times last year. There have been proposals to legalize sports betting in Minnesota from both DFLers and from Republicans. Is there a path to legalization in 2024?
I think so. I think it's a really important conversation. Chair Zach Stevenson has been working hard on trying to bring folks together in the House and make sure that we can find common ground and reach agreement. I think that the GOP, with some of the proposals they've had, have been underselling the tribes, and that's not a position that the House is going to take. We respect tribal sovereignty. We respect that the gaming rights that those nations have had and has resulted in a lot of economic opportunity for those nations. And so we're going to be working closely with our tribal partners to make sure that we can get a deal that'll work for everybody.
A bill to allow medical aid in dying has already garnered significant press coverage since it passed out of a House Health Committee, even before session has started. Is this bill a priority for your caucus?
Well, it's a bill I personally support. We haven't had the conversation, I think, as a caucus or with the Senate to see whether we have enough support to move it forward this year. But I've heard more on this issue from constituents than many others, and it's from doctors, and it's from often patients and individuals who have really sad stories and are facing terminal illness and want to be able to make that choice for themselves. I've experienced situations like this in my family where it would have been helpful for those individuals to not have to suffer for months on end and to have a choice for themselves if they were of free mind. So it's an important conversation for us to have as a state, and I'm glad we're having it.
House Majority Leader Jamie Long, I want to thank you so much for your time today.
You appreciate it.